Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is Vaibhav Shrivastava and with me is Anita Anand bringing glimpses of the major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment and more. The headlines. Government of India asserts that it is consistently and proactively working to secure and enhance availability of COVID vaccines. India records decline in positivity rate in the past week, around 18 crore COVID vaccine doses administered in the country so far. Bangladesh Prime Minister Sheikh Hasina assures everyone in Bangladesh will be brought under the COVID-19 vaccination program. President of the United States Joe Biden spoke to the Prime Minister of Israel Benjamin Netanyahu on the ongoing Israel-Palestine conflict. Bharat Biotech's Covaxin granted permission to conduct Phase 2 and Phase 3 trials for the age group of 2 to 18 years. And in football, the 2021 UEFA Champions League final shifted to Portugal owing to COVID-19 related travel restrictions in Turkey. As the number of COVID cases are on the rise, we appeal to our listeners not to lower the guard. Follow all the precautions and all those above 44 years who have taken the first dose of COVID-19 vaccine to get vaccinated with the second dose at the scheduled time. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Union Health Ministry has said the central government is consistently and proactively working to secure and enhance the availability of vaccines. It dismissed reports appearing in a section of media, followed by some uninformed tweets alleging delay in licensing for Covaxin and delayed approval for technology transfer for manufacturing Covaxin vaccine in the country. The Health Ministry said that these news reports and the content mentioned in the tweets are completely baseless and factually incorrect. It said the new liberalized pricing and accelerated national COVID-19 vaccine strategy aims at liberalized vaccine pricing and scaling up of vaccine coverage to incentivize vaccine manufacturers to rapidly augment their production and to attract new manufacturers. It would make pricing, procurement and administration of vaccines more flexible and ensure increased vaccine production as well as wider availability of vaccines in the country. The ministry said as part of its policy to augment the domestic production of COVID-19 vaccine, the government has proactively encouraged public sector undertakings as well as private companies to enter into technology transfer agreements with Indian vaccine manufacturers. 2 central government PSUs, namely Indian Immunologicals Limited (IIL) and BIPCOL, have entered into a technology transfer agreement with Bharat Biotech. In addition, one state government undertaking, namely Hafkin Institute, has also entered into a technology transfer agreement with Bharat Biotech. All these technology transfer agreements have been actively promoted and assisted by the Government of India. The ministry said as a result of this proactive intervention of the central government, Indian Immunologicals Limited will be in a position to start production of Covaxin from September 2021, while Hafkin Institute and BIPCOL will start production of Covaxin from November this year. The ministry said under the new policy, 100% doses of imported and ready-to-use foreign vaccine will be available for other than Government of India channel comprising state governments, private hospitals and hospitals of industrial establishments. It also added that the Government of India is proactively engaging with foreign vaccine manufacturers like Moderna and Pfizer to apply for emergency use authorization in India so that these vaccines can be easily imported and made available in India. India has reached a plateau in daily new COVID-19 cases and positivity rate in the last 3 days. The positivity rate in the country has declined from 21.95% to 21.02% in the last 1 week. Briefing media in New Delhi on Thursday, Joint Secretary in the Health Ministry, Love Agrawal, said 187 districts in the country have shown a continued decline in cases since the last 2 weeks. On the occasion, Niti Aayog member Health, Dr. V.K. Paul, said around 18 crore doses of COVID-19 vaccines have been administered in the country. He informed that around one-third of the people with 45 years of age and above are protected. He said so far 35.6 crore vaccine doses have been procured. Under the Prime Minister Cares Fund, 6.6 crore doses were procured and they have been received and utilized fully. Additional 16 crore doses are in the pipeline to states and private hospitals. Dr. Paul said 216 crore doses of vaccines will be manufactured in India between August to December this year. He added that there should be no doubt that vaccines will be available for all as we move forward. He also said the Sputnik vaccine has arrived in the country and expressed hope that it will be available in the market next week. Dr. Paul added that any vaccine that is approved by FDA, WHO can come to India and import license will be granted within 1 to 2 days. He also said that the Indian government has been in touch with Pfizer, Moderna, Johnson & Johnson from the beginning and invited them to come to India to manufacture the vaccines.
A total number of 3,62,727 new cases were reported in the country in the past 24 hours. The Health Ministry said 4,120 deaths were reported during the same period, taking the toll to over 2,58,000 across the country. The country's COVID-19 recovery rate stands at 83.26%, with a recovery of more than 3,52,000 patients in the last 24 hours. Presently, the total number of active cases in the country is over 37,10,000, which comprises 15.65% of the total positive cases. Meanwhile, Delhi's Deputy Chief Minister Manish Sisodia has said that the demand of oxygen in the city's hospitals have been significantly reduced with the decline in the number of COVID-19 cases. Briefing the media in New Delhi on Thursday, Mr. Sisodia said the demand for oxygen was over 700 metric tons earlier, which has been reduced to 582 metric tons now. Bharat Biotech has been granted permission to conduct Phase 2 and Phase 3 trials of COVID vaccine Covaxin for the age group of 2 to 18 years. The expert panel on the Central Drug Standard Control Organization has recommended the conduct of trials. The Drugs Controller General of India has accepted the recommendation of Subject Expert Committee (SEC). The trial will be conducted in 525 healthy volunteers. During the trial, the 2 doses of vaccine will be administered to the volunteers. The gap between the first and the second dose will be of 28 days. Meanwhile, the National Technical Advisory Group on Immunization, NTAGI, has recommended to increase the gap between 2 doses of Serum Institute of India's Oxford COVID-19 vaccine, Covishield, to 12 to 16 weeks. Currently, the interval between 2 doses of Covishield is 4 to 8 weeks. The panel has, however, kept the dosage interval for Covaxin unchanged. NTAGI has also recommended that those who have tested positive for COVID-19 and are waiting to take the vaccine should defer vaccination for 6 months after recovery. It said that pregnant women may be offered the choice to take any COVID-19 vaccine and that lactating women can be inoculated anytime after delivery. The recommendations of the NTAGI will be sent to the National Expert Group on Vaccine Administration for COVID-19.
A consignment of 30 oxygen concentrators, 2 ventilators and other medical equipment arrived from Italy today. India has thanked her EU partner for the support. External Affairs Ministry spokesperson Arindam Bagchi said this equipment will further augment the oxygen production plant gifted earlier by Italy, which is already functional at the ITBP hospital in Greater Noida. Earlier on Thursday, 1,200 oxygen cylinders arrived from the British Oxygen Company of the UK. India appreciated the logistical support from Qatar Airways for this shipment. Now let's take a look at the coronavirus updates from around the world. In Bangladesh, more than 90% of people have been found with antibodies after taking the Oxford AstraZeneca COVID-19 vaccine. In research conducted by the Institute of Epidemiology, Disease Control and Research IEDCR in Bangladesh, it was found that 92% of the people had antibodies 1 month after taking the vaccine. 2 months after taking the first dose, the percentage of antibody was found to be 97. The antibody presence was detected in people of all age groups who had taken the vaccine. The comorbidity among the vaccine takers was also found to make no significant difference in terms of the presence of antibodies. The research also found that the people who took the vaccine after being infected by the COVID-19 earlier showed 4 times more antibodies than the non-infected people. Meanwhile, Prime Minister Sheikh Hasina has assured that everyone in Bangladesh will be brought under COVID-19 vaccination program. In her televised address on the eve of Eid ul-Fitr on Thursday, Prime Minister Hasina said that her government has contacted multiple sources to procure 1 crore doses of COVID-19 vaccines, which is expected to arrive soon. She said that efforts are being made to domestically co-produce the vaccine also. The European Union's executive on Wednesday called on countries on the bloc to temporarily halt non-essential travel from India to limit the spread of a COVID-19 variant. Australia has secured 25 million doses of the Moderna COVID-19 vaccine as the government seeks to boost supplies to support its delayed vaccination drive. The U.S. Centers for Disease Control and Prevention, CDC, has given the green signal for using BioNTech Pfizer COVID vaccine in adolescents aged 12 to 15. Meanwhile, Cuba has started inoculating its citizens using 2 indigenously produced vaccines. According to reports, the vaccines Abdala and Soberana 2 are yet to complete their clinical trials, but authorities expect an official approval by June. This is All India Radio giving you the world news.
3 steps to stay protected and stay safe from COVID-19. Wear face mask, 2 gaz ki duri to maintain social distancing, maintain hand and face hygiene.
Israel is preparing ground troops along the Gaza border on Thursday while Hamas launched rockets at southern Israel. In all, 67 people have been killed in Gaza since violence escalated on Monday, according to the Enclave's health ministry. 7 people have been killed in Israel, its military said. Israel has prepared combat troops along the Gaza border and was in various stages of preparing ground operations, a military spokesman said. Amid fears of the violence spiraling out of control, Washington plans to send an envoy, Mr. Hadi Amru, for talks with Israel and Palestinians. Meanwhile, United States President Joe Biden spoke to Israeli Prime Minister Benjamin Netanyahu and later expressed hope that this conflict will be closing down sooner than later. But Israel has a right to defend itself. Netanyahu's office said he told the U.S. President that Israel would continue to strike at the military capabilities of Hamas and the other terrorist groups active in the Gaza Strip. In today's Hotspot section, we bring you an interview with Mr. Ashish Tripathi, CEO of Zar Labs. Mr. Tripathi will be speaking about a new breakthrough in cancer diagnosis.
Congratulations, Mr. Tripathi, for this breakthrough in the field of cancer diagnosis. Sir, kindly share some details of the diagnostic technique which your biotech company has developed in order to detect the cancer in very early stages and even 1 year prior to the growth of the tumor cells.
So core to our breakthrough is a specific set of cells that we have been able to isolate in blood for the very first time, and we were able to actually make an algorithm out of some markers from these cells which are indicators of early stage of cancer. So there are a couple of things that we can do. Not only can we detect cancer earlier than any technology, because we can detect it prior to tumor formation. This is a common test for all cancers. This is a prognostic test, so not only can it tell you you don't have cancer, we can in fact rule out the risk of cancer for the next 1 year if your HRC marker readings are within a safe zone. So we believe that this particular technology will not only help oncologists because we can provide a lot of data from a non-invasive process, a blood test essentially, but we can also detect this disease early when frankly this disease is infinitely more curable and causes a lot lesser pain to the patient and their families at large.
Mr. Tripathi, how is this technique different from the existing diagnostic techniques to detect cancer?
most of the techniques that are available today in the market are invasive techniques. What that means is that they do some sort of invasive procedure. For example, latest research shows that when you do a biopsy, you can speed up the activity of the tumor or the cancer. There are also PET scans and other imaging tests which do have radiation which are significantly higher than normal X-rays. So these are invasive procedures that can actually cause some harm to the patient. Now the latest research is a technique called liquid biopsy, where frankly a number of US companies have been trying to develop a blood test. But they have not had the success like we have, because essentially what they are doing is they are looking for the pieces of the tumor that are circulating in the blood. Now the problem with that method is that your body has 5.5 liters of blood. If I am taking only 5 ml of blood, that is only taking a small sample of 0.1% blood. And what happens is that if you can see the tumor pieces, you know that this person has cancer. But if you can't see the tumor pieces, you assume that this person doesn't have cancer. But in actual fact, the problem is that you have taken a very small sample. What we are looking at is a cell that actually exists in all of us. Like if I take a blood sample out from your body or my body, it will have white blood cells, it will have red blood cells. Similarly, it will have these stem cells. It is always present. And what we are doing is that we can get a reading when you have cancer, and it gives us a reading when you don't have cancer as well. So that is the fundamental difference between our methodology and what the American companies are working on. And hence, our success rates in terms of accuracy have been higher than what these companies have reported.
You just talked about liquid biopsy also as one of the diagnostic tools to detect cancer. Can you just tell our listeners, like, in what way you consider it to be better than liquid biopsy actually?
Let me put it in another way. They only reading for when the tumor is there. When you don't get a reading, it can mean two things. That the tumor is not there, or in the small sample of blood you took, there was no tumor piece there. So they assume the absence of the tumor piece to indicate that you don't have cancer. While what our marker does is it gives you a reading when you have cancer. It gives you a different reading by different stages of cancer. So it gives me a reading for stage 1, stage 2, stage 3, stage 4. But it also, that same marker gives me a reading for all stages of non-cancer. It tells me you don't have cancer and you don't have risk of cancer for the next year. You have imminent risk of cancer. Within the next 1 year or so, you are going to form a tumor. I get a separate reading for all these stages. And that is why our methodology, our marker, is significantly superior to what marker that these companies are using. To be very candid with you, for a cancer screening test, none of these have actually passed regulatory approvals for the simple reason that their success rates of detection are not high. If you are getting only CTC-based methods at early stages, there are scientific reports that put the success rate of detecting it at 5% or even lower sometimes. So if that is the case, how can that become the marker for cancer detection at an early stage? Now, there are companies that are using other methods which are indicating that you can hit 25 to 30% success rate at stage 1. But that is very different from the accuracy that we can achieve, where we have, in a 1,000-patient study, not had even one false negative, not one false positive.
Mr. Tripathi, with what certainty can this test actually detect and foretell the occurrence of cancer, or maybe it can diagnose it much beforehand, like you just said, a year before maybe?
The data is showing a very, very strong correlation. We are extremely confident about our technology, but there is a process laid out. So we have done a 1,000-patient study which allows us to actually get some regulatory approvals as far as India is concerned. But if you are trying to actually make a product that actually wants to enter the Western world, which is what we want to, we'll have to do trials in those countries as well. So that is going to be the next step of the process. But I want to clarify one particular thing. The first rule in medicine is do no harm. So when you are talking about medicines or vaccines that are given to people, the reality is that you need to be certain. The reason you go through phase 1, phase 2, phase 3 trials, etc., is you want to be certain that it does not do any harm to this person. What we are doing is we are just taking a small blood sample. So therefore, the regulatory approvals for us to get permissions is actually different, because what it is going to mean, what is going to make this into a success when it is launched, it is having success. And doctors believe that it is giving them meaningful data. So that that is where we believe we are not looking at the same kind of testing that actually has to be done for a molecule that is ingested. But that said, there are certain approvals that you need to do, and the company is working on that.
Speaking about the larger good, Mr. Tripathi, what is the benefit that people are going to get through this breakthrough diagnostic technique, and what effect is it going to have in their lives?
This is something that is very heartening for us. Cancer is, as I said, a weak disease if you catch it early. If you catch it late, it causes untold pain on the patient and financial burden on their families and the society at large. What we have done is a breakthrough that can detect the cancer early. And on all parameters, if you look at the amount it costs the patient to recover, if you look at the survival rates that the patient is able to defeat this disease, on all those parameters, if you catch the disease early, there is a significant advantage that the patient has versus detecting it late. What we envision, like I told you, is that all of us need to do this HRC test once a year, and we will either catch the disease at stage 1 or before, when frankly it is a lot less expensive, lot less painful, and where the survival rates for the patient are significantly higher. So what we envision as a goal for ourselves, we would like to see a world where cancer becomes an early stage disease rather than a late stage disease. It will save a lot of lives, and that is our mission.
You just talked about some clinical trials as well, Mr. Tripathi. What was the sample size for the clinical trials that has already been done on this? And can you share some of the outcomes as well?
It was a blind multi-center study where we actually just get a blind blood sample with a code on it. We were able to detect each and every, and the design of the study was there were 500 non-cancer patients and there were 500 cancer patients of different stages and different types of cancer. We were able to detect each and every non-cancer patient. We were able to detect each and every fourth stage cancer patient, say they were fourth stage, from a blood test. We were able to detect each and every third stage cancer patient, say they were third stage, every second stage, every first stage cancer patient. What was also interesting was that, look, in a blinded sample study, you are limited by which cancers get sent to you. We know technologically why these markers work on all cancers, but in a blind sample study, you are only limited to the samples that are sent to you. There were 25 different types of cancer sent to us. But what the oncologists were impressed by is that this particular test is working on solid cancers, it is working on blood cancer, it is working on sarcomas as well. It is working on different types of cancer, and all the big cancers were there. So breast cancer, lung cancer, prostate cancer, pancreatic cancer, colon cancer. So most of the big ones were already there. But we do understand that we have to do a larger study where we will want to cover all cancers. There are a little less than 200 cancers known to man, and we will make sure that we actually do a test on all of them before we can definitely actually make that specific claim.
That's really great to know, actually, Mr. Tripathi, that almost with a 10% of accuracy, the test can detect the cancer patients and non-cancer patients. In what part of the country or where in the world actually these samples were taken? Can you share some of that with us?
This was an India study. It was a CTRI registered study. The samples were taken from quite a few cities in Maharashtra, but also from Delhi. That's how the study was designed.
Have you moved for any regulatory approvals at this moment, and by what time do you expect to get the approval?
We are working on it. Our intent is to launch this service in India this year itself, and we have already reached out to some of the regulatory authorities. The reality is that the approval process is actually different for medicines that are being ingested versus a diagnostic test. And from that perspective, we have already reached out to some regulatory authorities, and we will be speaking to a lot of others. So this particular application was important because that is something that actually gets evaluated even by regulatory authorities. And the media attention that we have got over the last couple of days has also actually helped us in terms of knowledge of our breakthrough being known in India. I want to say that we are proud of the fact that this breakthrough has been made by Indian scientists, and given the fact that the clinical trials were actually conducted in India, we believe that this is the market where we are actually going to launch the service first, and we are making progress.
Mr. Tripathi, there is a small section of researchers which have always raised certain kind of questions on the basic foundation on which this diagnostic technique is based. How do you respond to their objections?
I think what you're alluding to is the debate in the stem cell world around the classification of certain cells, what our breakthrough is, but most of that research was actually done on cells that have actually been found in tissue. We were the first to actually isolate it in peripheral blood or from a blood sample. As we have taken images, we have actually studied these cells, we have actually studied these markers, we are very clear on the existence of these cells. But what really matters for a company or for a test like this to get approval is whether that marker is actually giving you the requisite result. In science, there's always going to be debate, but the fact is that we are very, very clear. Once we've taken images, once we've studied those cells, we are pretty clear on the existence of these cells. But what really matters is whether that marker is actually linking and giving interesting results as far as screening for cancer and non-cancer is concerned.
The discovery of the very small embryonic-like stem cells, yields with what you were referring to, have been put to a diagnostic application in this technique. Can you tell us, what are the further possible applications where VS-ELs can be put to use?
There are researchers in the US that are interested in looking at therapeutic use of these cells. We, because of our breakthrough, are really concerned around the diagnostic use of these cells. And the fact is that early days, but the reality is that we are able to actually provide not just the screening application for the cancer, we are also able to tell you which cancer and where it is growing from a blood test. And we don't want to make too many statements on that just yet, but because there are clinical trials on for that particular piece. But our early studies are actually indicating that we can do that quite accurately. And if you can do that through a non-invasive process like a blood test, you can imagine how applicable that is for oncologists and also for patients.
By when can people actually expect this test to be made available in the market? Any particular timeline that you're looking at?
We are looking at it being launched in India this year itself. This is the first market where this product is going to be launched, and it's something that we are very proud of. There's an emotional reason for us as a family, and like numerous others who've lost someone important because of this disease, and we believe that we can make a real difference to the lives of people suffering from this disease.
Thank you very much, Mr. Tripathi.
Thank you.
It has been shifted to Portugal. The clash between the two English clubs for Europe Club football's biggest honour will now take place in the Estádio do Dragão in Porto on the 29th of May. Earlier, the finals were slated to be held in Istanbul, Turkey. UEFA, in a statement on Thursday, clarified that following the UK's government's decision to place Turkey on its red list of COVID-19 travel destinations, staging the final there would have meant that none of the club's domestic fans would have been able to travel to the game. And now let's take a look at the major developments around the world as reported in the foreign press. New York Times reports that 2 climbers died near Mount Everest high-altitude death zone on Wednesday. Officials ruled out a link to the coronavirus, which is overwhelming Nepal's health system. Wall Street Journal writes that Surgeon General of the U.S., Vivek Murthy, said that a temporary waiver of intellectual property rights for vaccines was one step toward increasing supply and that booster shots might be needed. The Guardian reports that in Colombia, protesters call for an end to the police violence as demonstrations enter third week. The Sydney Morning Herald writes that New Zealand PM Jacinda Ardern said her government will explore more travel bubbles and lead trade delegations later this year. And the Himalayan Times reports that the NCP Maoist Centre Alliance fails to prove majority in the Nepal Parliament.
And now a quick look at the headlines. Once again, Government of India asserts that it is consistently and proactively working to secure and enhance availability of COVID vaccines. India records a decline in positivity rate in the past week, around 18 crore COVID vaccine doses administered in the country so far. Bangladesh Prime Minister Sheikh Hasina assures everyone in Bangladesh will be brought under COVID-19 vaccination program. President of the United States Joe Biden spoke to Prime Minister of Israel Benjamin Netanyahu on the ongoing Israel-Palestine conflict. Bharat Biotech's Covaxin granted permission to conduct phase 2 and 3 trials for the age group of 2 to 18 years. And in football, the 2021 UEFA Champions League final shifted to Portugal owing to COVID-19 related travel restrictions in Turkey. India celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let us listen to his favorite bhajan, Vaishnav Jan, by artists from Argentina. And with that, we end this bulletin. We'll be back at the same time tomorrow with the next edition of World News.